think it's important to remember that where you do your training year does not determine where you're going to be for the rest of your life. Like I said, pharmacy is such like an evolving career, and the skills you get during your foundation year are so transferable that it's not like a end all. Like if you do your community pharmacy placement year or foundation training year, it doesn't mean you're going to be in community pharmacy forever. The skills you'll pick up there are still so transferable, and although you might need to pick up some other skills or do some extra training before you start in hospital, it won't limit you to just one sector. Similarly to that, if you're in hospital, you'll have to do some training to get used to community pharmacy. So I think pharmacy is a career where we're always learning anyway. So just doing your foundation year in one sector and just learning one set of processes, it doesn't limit you to just that one sector.
Welcome back to the BBSA Beyond the Dispensary podcast. Today I'll be co-hosting with Molly, and we'll be talking to Elif, a trainee pharmacist at Imperial College London, and who ranked in the top 100 in the Oriel process. Listen as she shares all her tips and tricks to Oriel, as well as how to master managing studies. Hi Elif, welcome to the podcast. Would you mind just quickly introducing yourself?
So hi, my name is Elif, and I'm doing my foundation training year this year. It's in the hospital sector, and I went to Keele University.
Lovely. And maybe for students who don't know, what is Oriel and what is the process?
So Oriel is the national online portal which pharmacy students and other healthcare students use to apply for their foundation training placements. You get to complete 2 assessments, one situational judgment 1 and one calculations 1, and you preference which programs you would like to apply for, and then you get matched into your preference using your score and your preferences.
And how did you find the Oriel process?
Honestly, I did find it a little bit overwhelming at first. I feel like there were so many deadlines and things that I had to do. But I think once you go through the process, and if you do it step by step, it's not as overwhelming as you think it is. Once it's over, it's not that bad.
And how did you revise for your Oriel process?
So I think I started to prepare around 6 to 8 weeks before my Oriel test. And at first I felt a little bit lost, to be honest, but after doing a little bit of research, I found that there were some online providers. I believe Blackstone Tutors was one of them. So I used Blackstone Tutors for the situational judgment and calculations portion of the test. But I believe it also ProPharmace had some calculations. And there was a yellow book that every single pharmacy student will talk about that I used as well. And as well as that, my university provided us with some situational judgment and calculations practice during weekly learning sets, and just for us to practice on our own. So all of those were really useful. I also think I read through the professionals standards for pharmacy professionals, and that was really, really beneficial because it allowed me to kind of think about what the question was asking and how I could apply the standards to the question to see what kind of answer they were looking for. But yeah.
Yeah, that's amazing. I know you ranked in the top 100, so
Yeah.
that is a massive, massive well done for you. What made you, or what kind of motivated you to keep studying whilst you were revising?
I think at the beginning, I found it quite difficult because no matter what I was doing, I felt like I kept getting the questions wrong. Some of the questions were quite confusing, and I think one that stands out to me was one where a patient's asking directions, and I always found that one really difficult because I didn't know really what to do in that situation. And I believe sometimes, for example, the yellow book would have a different answer to what the official mock has, or some, etc. But the thing that motivated me to keep studying was that these are decisions that we'll have to make in the future, and even just as a pharmacy student. So I just really wanted to understand and apply the standards for pharmacy professionals to the questions to be able to choose the most appropriate answer, if that makes sense.
Yeah, absolutely. So, when it comes to preferencing, what do students need to know when they're deciding their choices?
I think there's a lot to consider, to be honest. I think when I was choosing my preferences, I made an Excel spreadsheet to be able to look at all my options clearly. For me, location was a big one. I knew that I wanted to move back home to London. And when thinking about location, I think it's important to think about if you're willing to relocate and if you're willing to commute to work and how long your commute will be. I think that's really important. You should think about commuting costs as well, rent, and your support network. And also, obviously, what kind of sector you want to do your foundation training year in, what kind of sector you want to experience, what you enjoy the most. Um, I think it's also really important to only preference places where you would actually want to go. Um, I had a few friends who ended up putting places down just because, and then they weren't quite happy with what they got. So I think that's really important.
Is there anything in particular in the job descriptions in Oriel that you would recommend that people look out for when they're considering their options for preference?
Definitely, I think reading the description is really important because it will show you how the program or the provider will support you during your foundation year. For example, I know that some places they give dedicated study time, other places might give weekly study sessions with professionals. It's really important to think about, what would work best for you. So some people I know the training, like the weekly study sessions, may not work for them, but dedicated studies time would really work for them. So it's really important to look at that. I think it's also beneficial to look at salary. It is important to see how much you're getting paid, especially if you're going to relocate and you're away from your support network. You need to see if that will work for you. So yeah, I think that's what I would think.
Leading on from that, would you say that there are any red flags in particular to look out for?
Any red flags? I think definitely anything below the legal salary. I know that when I was preferencing, some places in London were offering around £20,000, um, which is quite unfair. So it's really important to look at how much. I know it's bad to say to look at salary, but to really look at, is this ethical, and will you be able to survive on that?
So, how can you tell whether a option is right for you or what looks like a good option?
I think you'd have to really see if it balances with your lifestyle and what you're hoping to get out of your foundation year. I think before starting my foundation year, I didn't really think about commute too much, um, but I knew that I wanted to work in London. So you need to balance your interests and your lifestyle. So if you hate commuting, then probably finding somewhere that's closer to you. And if you would love to go to, I don't know, a world renowned hospital, then you might need to balance commuting a bit further to go there. But really to look at if it would work for you, because you're going to be there for a whole year and you need to have the best experience and make sure that it works for you and you're happy during that year.
Yeah, absolutely. And did any of your placements whilst you were studying influenced your choices of where you'd go?
Definitely. I mean, I didn't really experience any GP placements or industry placements, but they would have been interesting to see. I did community pharmacy and hospital pharmacy, and for me, hospital pharmacy was more enjoyable. I found it more interactive. I found it more interesting for me personally. So I knew that when I was doing my Oriel preferencing, that I just wanted to apply for hospitals. However, I think if I lived in a location personally, which was quite far from hospitals, I would have started applying for community pharmacies and GPs as well.
Hmm. And just to add on to that, how many places in total did you preference, and slash, how many places would you recommend people to preference?
I think this is quite different for everyone, and every time I tell people the number, they're always a bit shocked. Um, I don't think I suggest preferencing as little as I preferenced. I only preferenced around 30 places. However, I think for me, I knew that if I didn't get any of the places that I'd preferenced, I didn't want to go. And I would be okay with taking a year out and reapplying. So I think it's really important to think, well, I think it's really important to preference only places that you really want to go to. But I think it's difficult to balance that with the number of placements there are. I think that's quite like an individual choice for each person.
So I know you chose to move back to London, you said, to your home. How was that for you, and how did you find moving out for uni?
Honestly, when I first moved out for uni, I think coming from London, which was it is quite a busy place, going to Kiel, which is a lot of farms and a lot of cows, it was very different. But then it started to grow on me, like the quietness of Kiel and the friendliness of the people there. Um, but then when I moved back home, I think that was the biggest thing. The busyness of London never used to faze me. It was something I was really, really used to. But now, like going to Oxford Street, the thought of that, I'm like, no, it's too busy. Um, but yeah, I think moving back home is also different or difficult. Um, you get used to living by your own rules at your own times. And then when you move back home, you kind of have to reintegrate yourself into your family because they have been living without you for 4 years as well. So I think it's a lot of trying to get to know one another again, kind of. But it's been really good. I love London. I always have. And so it's been nice to be working here and being back home.
This is just a reminder that our Black History Month conference is coming up. Join us on the 1st November in the University of Birmingham to hear from inspirational speakers and empowering workshops. To find out more, make sure to follow us on our socials and keep up to date. So for any students going through the Oriel process now and that are anxious for the results, how would you recommend they deal with like the nervousness or the waiting process?
I think waiting for a result is always quite nerve-wracking, but it's really important to remember like your friends are going through this as well. And it's not the end of the world no matter what happens. I think it's really important to remember that you've done the most you can and you can't really go back and change exam results, etc. now. So just enjoy the next couple of weeks or months until you have to think about where you're actually going to go for work. um, Everyone is in the same boat as you. You're all in it together. I think that's all I can say.
And do you have any suggestions or kind of reassurance for people that maybe things don't go to plan for them?
Like I said, it's not the end of the world. There are always other opportunities that will arise. I think pharmacy is such an evolving career. Like there will always be something that comes up, and I know of some people who didn't get their first choice or didn't even get their top choices, and they really are enjoying their placement or their program. So I think this is not the end of the world. Obviously, if you really, really, really hate it, then you always have the option to reapply. But I would suggest giving it a chance because you might be surprised.
Definitely. Thank you for that. I think that's great advice. I know a lot of people, not a lot of people, I know a few people who unfortunately didn't get the first choice, and everyone's still really enjoying it. And I think it's so important to remember that everything happens for a reason. And I think that's something else to remember with oil.
Definitely.
Yeah, absolutely. Now, with the independent prescribing coming out, how do you feel prescribing and coming out as an independent prescriber?
Honestly, I think it's a bit scary. I think as the years that are coming out with the independent prescribing, we need to have a lot of practice before we do start prescribing. So far, I haven't actually started training in or started working on my prescribing hours, but that's because I've had less patient-facing rotations. But I should start soon, and I'm really looking forward to it, and I'm excited. But I think it's really important to be cautious, because just because we are independent prescribers, it doesn't mean that we're competent to prescribe just yet. So yeah, I think I'm not in a rush to prescribe. I'm just trying to learn and become as competent as I can.
What rotations have you had so far then?
I've been in dispensary and I've been in medicines information so far, but my next rotation will be cardiology. So I'll be looking at that'll be more patient facing, obviously.
Hmm, that sounds very interesting. I'm just interested to know, what does kind of day-to-day life look for you a little bit as a pre-reg working in hospital?
So I think it depends in what rotation you're in, or if you've got any study hours. But for me, in the hospital sector at the minute, in my dispensary rotation, I get into work, I'm working on inpatient prescriptions, chemo prescriptions, um, renal dialysis unit prescriptions, and then in the afternoon, there's more of a focus on TTAs, TTOs. I swear everyone everywhere says it differently. Prescriptions. Um, we've got certain logs to complete, so dispensing logs, CD logs, clinical trials, and labeling, and just trying to work through them at the minute. And then once a week, we have a study session with the rest of the trainees at my NHS trust. So there's always 2 people out of the 18 of us that present a chapter from the BNF. And then we have teaching from a professional, for example, a pharmacist trained in respiratory, and she'll teach us like about asthma or something. And then we usually do a quiz, and then I commute home. And at home, I think it's really important to de-stress at the minute. I'm not starting revising or anything right now. So I just think it's really important to de-stress and rest before the next day.
Yeah, absolutely. That's a really good point that you've made of after you commute, relaxing, decompress. It's really important to do that. So, coming from being a student into a trainee, what do you think is the biggest challenge that people might face or that you faced yourself with that transition?
I think for me, it is a very different environment, because now people are relying on you to get things done. As a student, it's kind of more about, for me at least, it was more about kind of learning and observing, whereas now you are a member of the team and there are things expected of you to do. And if you don't do them, then patients can be affected. So there is added responsibility, of course. And I think that with friends, all my friends are in different parts of the country. So when you could see them every single day at uni, you can't do that anymore. And I feel like trying to plan in when to see your friends is so difficult because everyone's doing something else. But yeah, I think those are the biggest changes for me. It is really enjoyable. I still feel as supported as I did in university with my designated supervisor and line manager, etc. But it's a lot more independent and you have a lot more responsibility.
Yeah, that's really amazing and really good. And you mentioned working with different professionals. What's it like working in a multidisciplinary team?
I think it's really interesting because so many people are so educated, they're so smart, and just being around like different professionals from different disciplines means that you pick up so much without even realizing it. And it's really important to be able to take what they teach you and take different things that they do or their skills and apply it to your own practice. For example, for me, something that's always stood out is how nurses interact with patients. And I think one specific example that stands out to me was not even during my foundation year, but during placement. And I was in my ICU placement, and there was a nurse just braiding the hair of a patient who was getting blood work done. And, that really touched me. That really showed how caring nurses are and how they put the patient first, and how just little human things like this might make the patient's stay just a little bit better. The patient might be going through the worst day of their life. And so just picking up little things that other disciplines do and applying it to your own practice, I think, is so important, because you might not think to do those things.
Yeah, that's a really moving story. I think taking that little bit of extra care is something that we can all do as professionals. So I think that's really amazing. So what's the biggest thing that you've learned so far this year?
I think the biggest thing I've learned so far is just to look at the patient as a whole. I think with pharmacy, sometimes we might focus on the drugs, just the drugs. But I think it's really important to remember that this is a person, that this is someone with a family, with friends, their own life, and the ways we can empower them and help them with their medications can make massive changes to their lives. For example, someone struggling with inhalers, you could suggest aids with that. You could suggest MCAs with drugs, or when patients are really struggling with taking their medications themselves, if they're forgetting to take them, just suggesting things to help them with that. It helps their care. It might help their treatment. It definitely helps their treatment, but it helps that person with their life. And I think that's really important to remember.
Yeah, absolutely. Absolutely, that's amazing. So just thinking back to the Oriel process, now that you've gone through it and you're starting your trainee year, is there anything that you would have done differently if you had the prior knowledge?
I think for me, I think I would have started preparing a bit earlier, and I would have moved my exam earlier as well. Because when I did my Oriel exam, it was after my fourth year had started. So I was trying to balance a couple of the early lectures and also preparing for Oriel at the same time. So for me, I would say to make sure, not to make sure, but to try and do your exam before uni starts or as soon as you can. And so you'd have to kind of move your revision schedule, but just get it out of the way, and then you can just focus on your fourth year.
Yeah, that's really valuable. I think students are definitely going to learn from that.
This is a question we get quite a lot from students about switching sectors following the foundation year. And I know you're still in the foundation year now, but I was just wondering if you've met any pharmacists or had any insights on what it's like to swap sectors as a qualified pharmacist.
I haven't had too much insight, but I do know of hospital pharmacists where I work now who did their pre-reg or foundation year in community or GP. And for them, I think it's important to remember that where you do your training year does not determine where you're going to be for the rest of your life. Like I said, pharmacy is such like an evolving career, and the skills you get during your foundation year are so transferable that it's not like a end all. Like if you do your community pharmacy placement year or foundation training year, it doesn't mean you're going to be in community pharmacy forever. The skills you'll pick up there are still so transferable, and although you might need to pick up some other skills or do some extra training before you start in hospital, it won't limit you to just one sector. Similarly to that, if you're in hospital, you'll have to do some training to get used to community pharmacy. So I think pharmacy is a career where we're always learning anyway. So just doing your foundation year in one sector and just learning one set of processes, it doesn't limit you to just that one sector.
Yeah, I think that's really valuable. Thank you. Okay, we're going to ask some quick fire questions. That would be okay with you?
Yes.
So what was your favourite part about being a pharmacy student?
Honestly, although I enjoyed the content and I really enjoyed applying content when on placement, I really enjoyed just being with my friends and being a student. I think it's really, really important to enjoy your student life, to enjoy like silly little things you do with your friends, like, I don't know, just having random midnight chats together, etc. Because when you do start working and when you're all in different parts of the country or even in different countries for your foundation training year, it's really difficult to do that. So enjoy being a student. That was my favorite part. It was just doing silly little things with my friends.
Did you have a favorite year at uni?
I think fourth year was actually my favorite, and that I think it was quite an unpopular year actually for other people. But for me, I found third year very difficult. So in fourth year, it allowed me to prove to myself that I was really capable, and like the blocks started dropping. Like I started actually understanding in fourth year. Um, Everything kind of started making sense. I started understanding the questions better. I could deal with patient cases better, and yeah, I really enjoyed it, even though it was my final year and I had that massive dissertation to write. It was really good.
And finally, if you could be any drug, what drug would you be?
I was thinking about this, and I'm actually not sure, but I thought maybe paracetamol because it's always there. It's really reliable, and yeah, it's just a go-to drug.
You can't go wrong. And just as like a side note, is there anything else that you want to mention?
Just to not stress. I know that's so easy to say after you go through the process, but it's not the end of the world, whatever happens, and there'll always be someone to support you. Your friends are going through it at the same time. Your university will support you. Just enjoy being a student, I think.
Yeah, that's really important. Thank you for sharing. Thank you for being on the podcast. I hope you've enjoyed it.
Thank you for having me here.
Thank you for listening to this episode of the podcast. Even though I'm only in my second year, I feel like I'm ready to master Oriel thanks to Elif and all her wisdom. Hopefully you've taken away some key information and tricks about Oriel. Don't forget, if you have another inspirational student or trainee, our PharmStar nominations are open and you can nominate them now. See you in the next episode as we go beyond the dispensary.